sunspots, dark spots, fine lines, wrinkles. If you want to stay snatched, you need to be doing something about your sun protective measures. Hello, I'm Dr. Angelo Landriscina, and I'm a board-certified dermatologist. Looking for medical information online could be unreliable or anxiety-provoking, so today I'm going to be answering some of the questions that might be getting under your skin. Can retinol be used on the body? The answer is absolutely. They could be used for some of the same concerns that you would use retinol on the face for. Some of the signs that go along with photoaging, think discoloration, maybe rough, bumpy skin. In addition to that, there are prescription retinoids that are specifically indicated for use on the body. Usually those will be used for acne. The difference between a face retinol and a body retinol product is generally the concentration of retinol used. It's likely to be lower in a body retinol product just because you're covering a larger surface area. Also, the vehicle in which the retinol is dispersed is likely to be different. Our body skin tends to be quite thick and robust compared to facial skin, so it's going to need a different type of vehicle to have the best result. Can eating dairy products make you break out? The answer is kind of a big maybe. I think a lot of the interest in this topic has come from some of that standard classic advice that a lot of us got as teenagers. Oh, if you eat better, if you drink more water, if you do this or that, your skin will clear up. And I would like to say that in most cases, those people were wrong. A lot of this comes from an idea specifically about acne in general, that it is a personal failing that needs to be blamed on the person suffering with it, when really it's a chronic inflammatory skin condition. It's a medical condition and it should be taken seriously. Not only because it could cause physical scars, but also because we know that people with acne suffer higher rates of mental health disorders and even things like suicidal thoughts. There has been quite a bit of interest about the correlation between diet and acne within the dermatology community too, and there have been a lot of studies about it. There have been correlations between eating high amounts of dairy products, eating certain dairy products, and more severe acne. However, there's been a lot of variation and a lot of gaps in the data. So a lot of these studies can only be generalized to certain age groups or certain parts of the world, certain diets. Breaking it down in a nutshell, I do think that for some people, certain dairy products could cause a worsening of acne. However, I think it's very unlikely that for most people that dairy products or other features of their diet could be giving them acne. I always say it's never too late to start being consistent and really paying attention to what your skin needs. For most people, your skin's not gonna need that much. A basic skincare routine should consist of a cleanser, a moisturizer, and a sunscreen. Each of those is gonna play an important role in keeping the skin healthy. The cleanser, that's going to prep your skin, remove any debris from the day, remove makeup if you're a makeup wearer, really just set you up with a clean canvas. The moisturizer to really aid your skin's barrier. One of the primary functions of our skin is to keep what's inside in and to keep what's outside out. And one of those substances that it's trying to keep in is water. So using a good moisturizer is going to help keep your skin hydrated, healthy, glowing, and then perhaps most importantly, sunscreen. UV exposure is the primary modifiable risk factor when it comes to skin cancer for most people. Using sun protective methods that include sunscreen, protective clothing, seeking shade, all of those things is going to be really important for keeping your skin healthy. In addition to that, I am in the business of appealing to people's vanity too. So it will keep you looking younger for longer. It's gonna prevent or help to treat some of those sunspots, dark spots, fine lines, wrinkles. It's also implicated in the loss of firmness in the skin. So, if you wanna stay snatched, you need to be doing something about your sun protective measures. When it comes to the basics, between age groups, say 30s, 40s, 50s, 60s, beyond, there's not really gonna be much of a difference in the product profile that you're gonna need in your basic skincare routine. However, there might be slight tweaks. For instance, as we get older, we do have differences in how dry our skin is. Skin tends to get drier as we age, so you may wanna go for a thicker moisturizer or a gentler cleanser than you would when you were younger. Once you have the basics of a skincare routine down, you could definitely look at adding more products based on what your specific concerns are. I'm a big proponent of what I call intentional skincare. So I always tell people, including my patients, don't just buy a new flashy product because it looks nice, or your friend told you it was great, or the marketing got you. Really look at your skin, take an inventory, and see what about it you want to address, whether it be something like dark spots, acne, fine lines. You're going to want to look for the product that will address your specific concerns. Oh, I love this question. Is there a difference between a sunscreen and a moisturizer with SPF? Not really. To me, most of it is marketing. A lot of the ingredient profile in the sunscreens that are out on the market and moisturizers are really similar. The only thing that I would caution people about is the fact that that SPF rating is based on using a certain amount of the product. So if you're using a pea size of that moisturizer with SPF, that's not enough. You're not going to be getting the SPF listed on the label. I know for most people, it's gonna be hard to have an exact science for, knowing how much of each product to apply. So what I tell people for facial sunscreen is you could follow what we call the 3-finger rule, doing a line of sunscreen down each of your 3 fingers, and that's how much you should apply for the face, neck, and ears. If you want to keep it simple, just use more than you think. It's really a lot more than people would think, and I really feel like most of the population is under applying sunscreen. Do collagen supplements actually work? You may see a whole slew of collagen pills, powders, shakes, etc. out there on the market, and a lot of experts would say that these aren't going to do anything. Just based on logic, collagen is a protein, which means it is a long strand of different compounds. When we take protein into our gut, it gets digested by the acid in our stomach and by enzymes. So you would think that ingesting collagen wouldn't do anything, but there is some data out there showing that it actually may make a difference for skin. First, there are animal studies that do show that collagen induced orally does make it to the skin as collagen. We're not really sure if that happens in humans, but it does give us a little bit of hope. In addition to that, there have been some studies showing improvements in things like skin hydration for people who are on collagen supplements. Is it a gold standard treatment for anything? No. I definitely think we need more data before we could be really prescriptive with collagen supplements. But at the same time, it doesn't seem like it'll hurt. So when should you start Botox if it's something that you want to pursue? I think it's hard to put an exact age on when to start. What Botox is a neuromodulator. And what that means is that it cuts off some of the crosstalk between nerve and muscle and causes a temporary paresis in facial muscles. The reason you want to do that is to prevent or treat expression lines. Those are lines that come up on the face from repetitive facial movements. Things like raising our eyebrows, grimacing, smiling with our eyes. For most people, I think it's okay to start Botox when you're starting to see those lines come up. If you're in your 20s and you have those lines already, you could be a good candidate if it's something that you want. If you're in your 60s and you don't have those lines, it may not be something that you need. There's been a lot of interest recently in preventative Botox, so using smaller doses in people who don't have lines yet in order to prevent them from coming up. When it comes to whether or not that's a valid approach, by logic, it would make sense that it would work. However, we have no scientific data showing that preventative Botox actually does anything. I hope this has been helpful. However, keep in mind, everybody's different, so make sure to check with your own doctor who knows you before making any changes. You can find me on all social media at Dermangelo.